Thank you
Hi.
for presenting tonight.
Oh, thank you so much for having me. What a great opportunity. So my name's Carly Zaid. I'm an occupational therapist and certified lymphedema therapist. I work out of Skokie Hospital, and a large proportion of my caseload is breast cancer survivors and breast cancer patients. So I'm really happy to be here to talk to you all about lymphedema and risk for lymphedema and kind of how to manage that as you move through your treatment and survivorship journey. The presentation objectives are here. I want to take a little time to define lymphedema and review the anatomy and physiology associated with lymphedema. I want to talk about lymphedema risk factors and risk factors that are related to surgery or cancer treatment. Next, we can discuss the role of lymphedema therapy in promoting lifelong lymphatic wellness. And then, should you have signs and symptoms of lymphedema, we can talk about the next steps to take. And like Lisa said, we'll finish with a Q&A. So we'll start with is lymphedema. Um, just really briefly, lymphatic system is kind of a uh, un under-recognized and underappreciated system in our body. Um, Basically, what happens is all of the garbage that is too large to fit in your blood vessels gets squeezed out and then taken up by a different set of vessels called lymphatic vessels. It creates a substance called lymph, and the lymph is really just protein, water, cell debris, waste products, sometimes germs and viruses, fat, and that gets basically filtered out of the blood and the surrounding tissues, and then taken through the lymph vessels to the lymph nodes. Most people aren't aware your body is full of lymph nodes. Most of them are in the head and neck. Then you have some under your arms in the axilla or armpit. And you have some in your groin or inguinal region. Those lymph nodes are where your lymph is filtered of all bacteria, toxins, dead cells. It creates white blood cells to help fight an infection, and it also helps regulate the concentration of protein in lymphatic fluid. When the system works, the lymphatic vessels drain fluid from all the surrounding tissues. The lymph is filtered through lymph nodes, and then that filtrate is returned to the blood circulation through your veins. Unfortunately, cancer treatments can damage the lymphatic system, which interrupts lymphatic flow. So what happens then is that fluid that is supposed to be filtered through instead accumulates in the tissues. In the early stages, this is seen as swelling, and it might be soft to the touch. If you press on it, it might make a little indentation, what we call pitting edema, and it might reduce or resolve with elevation. Early on in a lymphedema presentation, patients say, I wake up and I feel my arm is normal, I feel fine. And then as the day goes on, the involved area starts to get heavy. You may notice some visible swelling, and then you go to sleep and wake up and it starts all over again. In later stages, scar tissue will make the edema firm and hard. You won't be able to make an indent when you press on it, and it's more difficult to reverse. So you will go to sleep with lymphedema, swelling, and then also wake up with that same swelling. Um, I like to use this sort of as an analogy for the lymphatic anatomy. I think a lot of us are unfortunately familiar with this image. Um, what Imagine your lymphatics are like a highway system transporting from various parts of your body to be processed by your lymph nodes and then returned to your veins. Sometimes, such as when you're on the highway, for example, there's construction, lane closures, and then traffic gets backed up. If you're coming from the North Shore, traffic can get backed up pretty far, sometimes far as Dempster Street, sometimes even further. And then, when there's a Cub game or a concert, we see the same thing. So any sort of obstruction or closure causes this backup in a traffic jam. In the lymphatics, when lymphatics are damaged, then the fluid, that's the car, becomes congested in the vein. That's the highway lane. And then all of those areas become full of traffic. And then you're sitting in 2.5 hours of traffic trying to get into the city. So it's sort of the same idea with lymphatics. It's a traffic jam. There's not enough, there's not enough space for the fluid to go. So it just pools. And then over time, if it's not addressed, your body will mount an inflammatory response to it and put down scar tissue, which will then make it more difficult for that fluid to drain. And we sort of see a snowball effect with the swelling getting worse. This picture here shows a normal arm. This is meant to show the quadrant of the body that's most affected by breast cancer treatment. So you'll see here, it's not just the arm. I have the breast here, the side of the chest, and then this is showing the direction of flow. This is where lymph drains in the arm and it flows toward the lymph nodes in the armpit so it can be processed and then returned to the circulation. Here is meant to This X is meant to represent either lymph node removal or dissection, radiation to the area, and that is going to cause the traffic jam. So fluid will get backed up in the arm, and that is lymphedema in a nutshell. So when the lymphatic system is damaged, traffic is obstructed and fluid becomes congested in the arm, breast, and chest. In the healthy lymphatic system, fluid is freely drained from the arm, breast, and chest. There is no congestion or swelling. So you can see in these two photos how just that little area of obstruction can lead to all of these downstream side effects. We define lymphedema as when the lymphatic system is unable to perform its most basic function, which is really to remove excess water and other substances from the surrounding tissues. Down here in the lower left corner, you can see a general progression of lymphedema if left untreated. Lymphedema is a progressive disorder. If it is untreated, it will eventually progress to the point where the arm is quite swollen with a lot of um, skin changes. You could be more susceptible to infections. You really want to try to address it as early as possible in these first phases here. Once you get to this phase, we can make it we can improve it. It's probably never going to look quite like the other arm. And you will have to wear compression full time. This little diagram here just shows how a normal system works. Fluid enters the area around your cells and the fluid goes right back into the system. Here, more fluid is entering the system with this big fat arrow, but not enough is getting out of the system. So it accumulates because there's an imbalance there. There's two types of lymphedema, primary lymphedema and secondary lymphedema. Primary lymphedema is actually quite rare. It's lymphedema that you're born with. Some people have symptoms as soon as they're born, and some people develop symptoms later on in life, especially after puberty or in women after they have children in their 30s. It's really just you're born with malformed lymphatics. It's not really associated with any other disease or injury. An example is Milroy's disease. That's mostly in men, and that is usually diagnosed at birth. And then Meigs syndrome in females, which the onset is usually puberty. So they think it may be associated with hormonal changes. Secondary lymphedema is accumulation of fluid due to damage in the lymph vessels and nodes. So here in the US, that's most commonly the result of cancer treatments like lymph node surgery, radiation, some chemotherapies. You can also see it caused by trauma, like a serious fracture, complex fracture, infections or cellulitis, surgery, obesity, and vein disorders. You can see it in the head and neck, breast, in gynecologic cancers, and also in prostate cancers. Symptoms as it applies to breast cancer patients include swelling, usually in the breast, chest wall, arm, or axilla. So this whole upper quadrant here can be affected. People report pain. A lot of people report sort of a dull, achy pain or tingling, especially worse at the end of the day in early stages of the disorder. People report stiffness, numbness, and tingling. Limb heaviness is a big red flag, especially at the end of the day or during activities that don't normally cause you fatigue. And then in later phases, you can see changes in skin appearance and texture. And it's important to note that if you have like a rapid, sudden increase in swelling or severe pain, really tender to touch, redness, warmth, you need to contact your doctor to rule out something more serious, like a blood clot or an infection. So usually the first thing I would have you do is call your doctor if you start noticing signs of lymphedema, and then they can rule out all of the scary stuff and send you to us if it is lymphedema. So we can talk a little bit more about lymphedema risk as it relates to breast cancer treatment. This table is the result of most recent research and literature reviews. What the researchers did was they divided patients into three groups: lower risk or less than 5% chance of developing lymphedema, intermediate risk or 5 to 10% chance, and then the higher risk or greater than 10% chance of developing lymphedema. So here what they did is they established guidelines for how often the patient needs to be monitored and then what to do if the patient starts to have symptoms of lymphedema. Um, Screening for this is very important, especially early, because the earlier you catch lymphedema, the easier it is to treat, and the less burdensome the symptoms are on your day-to-day life. You really want to get there early and prevent a big change in the volume of your arm. So, patients at low risk for lymphedema are categorized by the researchers as people who've had a sentinel node biopsy with less than 3 lymph nodes removed, having a body mass index less than 30, and living in a non-rural residence, meaning you live in an area where you have good access to healthcare and other resources. So the recommendations for someone like that would be to obtain baseline measures before your surgery, before any cancer treatment, with a certified lymphedema therapist. After that, after 3 months after starting treatment or having your surgery, you would have follow-up measurements with the certified lymphedema therapist. This is post-operatively. And then every 6 months, you will see the lymphedema therapist or should see the lymphedema therapist for the first 3 years post-op. So every 6 months for the first 3 years after surgery, it's recommended to have measurements done by a lymphedema therapist just to make sure that there's no changes in your arm volume. That's a really good way to catch something like this early. From 4 years on, post-operatively, the screening is optional for someone who's considered low risk. So someone who had less than 3 lymph nodes removed, a body mass index less than 30, and lives in an area with a lot of healthcare resources. And right here, I just added this little picture of a sentinel node biopsy. We see these pretty commonly now in breast cancer surgeries. They've gotten really good at avoiding taking all of the lymph nodes like they used to. It used to be that you would be diagnosed with breast cancer and they would remove everything. But now they've gotten really good at conserving the breast, removing as few lymph nodes as possible. And that has dramatically decreased the incidence of lymphedema in the arm. It still happens. It can happen in the breast and the trunk as well, but they have come a long way in helping women avoid this. So now we just need to make sure that we're monitoring people early on so that we can catch it early if it does happen. For patients at an intermediate risk, that's defined as have someone who had a sentinel node biopsy with more than 3 lymph nodes removed, having a body mass index greater than 30, certain types of chemotherapy, people who do not have access to regular healthcare resources, and people who have had radiation in this sorry, this is a very hard word for me to pronounce, supraclavicular fossa. So that's just this little depression right behind your collarbone. Sometimes they'll do radiation there, and that does increase your risk of lymphedema. And then ALND, that's a axillary lymph node dissection. That would also put you at an intermediate risk along with these other things. So in that case, the recommendations are just like if you are at a low risk to get baseline measurements with the CLT before your surgery. After your surgery, it's recommended you follow up with your lymphedema therapist 3 months following the surgery, just like for low risk, then every 3 to 6 months during the first 3 years postoperatively. At years 4 and 5 postoperatively, it's recommended you get measurements with a CLT every 6 months. So it's much more frequent, comprehensive follow-up if you have an intermediate risk of lymphedema, up to 5 years after your surgery. Um, During those follow-ups, if they find that your limb measurements are between 5% and 10% higher than the uninvolved limb, you should be issued a compression sleeve or given an order to obtain a compression sleeve and gauntlet. A gauntlet is really just a glove with the fingers cut off. So the reason for that is if you wear a compression sleeve that ends at the wrist, it tends to push fluid into the hand, and the gauntlet just prevents that from happening. So the first thing to do is get fit for a well-fitting compression sleeve and gauntlet. We recommend you go and get fit at a certified fitter. Your therapist can give you information on fitters in the area. And the reason for that is a poorly fitting garment can cause more harm than good because of limb constriction. So it's important that those garments are well fit for you. The compression is then worn 12 hours a day for 4 weeks, and then your limb measurements are reassessed by a CLT at that time. These are not meant to be worn overnight. You put it on in the morning when you wake up, and then you take it off at night before bed. They are just too tight for nighttime wear. Um, if your measurements go back to normal after 4 weeks, you can discontinue the compression and or wean from it under the guidance of your therapist or your doctor. So overall, more frequent follow-up with a lymphedema therapist for those considered at an intermediate risk who had more than 3 lymph nodes removed, radiation above the clavicle, or lymph node dissection, or have a BMI greater than 30. Um, then, if your limb measurements are between 5 and 10% larger compared to the uninvolved side, that's when we would start to intervene and issue compression. At a high risk, this is for patients who've had a lymph node dissection. I believe that's more than 9 lymph nodes removed. People who have a body mass index greater than or equal to 25, when you have radiation to the armpit or axilla, um, certain types of chemotherapy, and again, that radiation above the collarbone. Here is just a picture of the area involved in an axillary node dissection. There are a few layers of lymph nodes there. They're kind of like bunches of grapes. The more nodes you remove, the more you're going to obstruct the traffic or the lymph being drained from that arm and upper quadrant, and the more likely you are to have congestion or swelling. And this is just a picture of someone undergoing radiation. So this is typically the radiation field they use. If sometimes they do a boost to the armpit or above the collarbone, sometimes they do a boost to a scar or the nipple. It really depends on your individual treatment plan with your radiation oncologist. So if you're at a high risk, like patients at an intermediate and low risk, you're going to obtain the baseline measurements pre-surgery. It's really helpful to know what your normal arm looks like and the normal volume of your arm, so we have something to compare it to. After that, after your surgery, you follow up with your therapist at 3 months and then every 3 months during the first 3 years. Following that, and years 4 and 5, you follow up every 3 to 6 months. The red flag for intervention or therapy is a 10% increase in the measurements 15 centimeters above and 15 centimeters below your elbow. Here, we want to issue compression. We may do a course of complete decongestive therapy, which I can explain later. That is the gold standard of treatment for lymphedema in certain cases. It consists of manual lymphatic drainage, compression bandaging, decongestive exercises, skin care, and the goal of therapy is to decrease the size of your arm for maintenance compression. Sometimes if it's caught early enough, you can just get into that sleeve and gauntlet and not have a problem. If your arm is really large, if it meets these, oops, I'm sorry. If it is more than a 10% increase in your circumferential measurements or your limb volume, you need complete decongestive therapy. The goal is to decrease the size of your arm. It's very uncomfortable to put a sleeve or a glove on a limb that's not decreased or decongested, and you can have some issues with skin integrity, limb constriction. So what we do is we use a system of multiple layers of bandages from the fingertips to the armpit, and these serve to move fluid along a gradient of pressure, move it past the damaged areas so that intact lymphatics can take it up and deal with it. So lymphedema therapy, or complete decongestive therapy. There's two phases. The first phase is the decongestive phase. This is the phase where you come to the office, usually 2 to 3 times a week. The therapist will do manual lymphatic drainage, which is a very gentle manual technique where we move fluid from the congested areas to the intact lymphatics. It's very gentle. I wouldn't even call it a massage. It's just a very light touch. A lot of these lymphatics are right under the surface of your skin. So having it done to you is a unique experience the first couple times. It's not what you normally would expect from going to a physical or occupational therapy appointment. After that, we apply the compression bandages. In the meantime, we're going to monitor your skin. We'll teach you how to do proper skin and nail care. And we'll show you some exercises to do once the bandages are in place that will help the bandages move fluid. Once your limb is reduced, so once your measurements start to plateau, then we know it's time for you to transition to maintenance compression, or enter the maintenance phase of complete decongestive therapy. This is the part where it's your job. So once you enter the maintenance phase, then you will take over your skin care. We'll teach you how to do manual lymphatic drainage to yourself. You'll do your exercise program prescribed by the therapist, and then you'll wear your compression garment as prescribed by the therapist. Another quick note about manual lymphatic drainage. It's a specialized gentle massage technique that stimulates the lymphatic system. We always start by stimulating the lymphatics in the center of your body. So where you see these circles in the neck, collarbones, in your abdomen, even your groin. We're going to stimulate all of those areas so that they're prepared to take the volume of fluid we're about to send their way. Next, we'll gradually move to working on the affected arm. And then we start at the shoulder and we'll work our way down to the hand to collect all of that lymphatic fluid. And then we'll bring everything up the arm back to the shoulder to promote drainage. We follow special pathways. There's lots of ways to reroute this fluid in the body. It's just like taking the back roads instead of the highway. And they these systems are adaptive for us so that if there's damage, there's ways around it. You just need to use manual techniques to get there. The oh, there it is. The multi-layer compression bandaging portion, this is pretty much what it looks like right here. Like it's a series of bandages starting at the tips of your fingers, going all the way up to your arm. Um, Believe it or not, you can do most activities with these on. You do wear them all the time once they're put on by the therapist. So you can't take them off to shower or anything like that. You can't get them wet. Most people just use like a bag or a cast cover you can get at Walgreens when they shower. But you keep these on in between sessions. The therapist applies them. You wear them for a couple days, you come back to therapy, we take them off, and then we measure. And if you're still decreasing in size, we'll do it again until your measurements plateau. The reason for these bandages is it creates an external pressure gradient. In the human body, in all biology, basically, fluid moves on its own from areas of high pressure to low pressure. What bandaging does is it creates this pressure gradient externally, starting at the hand. We have more bandages at the hand, that's more pressure, and then less as we go up toward the armpit. So there will be fewer bandages up here, it won't be as tight, but that will help move fluid along the length of the limb so we can get it past the damage to the intact lymphatics. So in therapy, after we do manual lymphatic drainage, we apply the bandages. Like I said before, they'll remain in place. You treat it like a cast until your next session. When you come back, we remove the bandages. We check your skin for irritation, do skin care if we need to, wash your arm and take measurements again. Once your measurements plateau, we know it's time to transition to maintenance compression. These bandages do look a lot like ACE bandages, which more people are familiar with, I think. These are not ACE bandages. ACE bandages are very elastic. They're very stretchy. If I pull it, I can get probably like stretched to 100% of its tensile strength. Short stretch bandages, while they look like ACE bandages, are different. They are not as stretchy. I could probably only get like 30 to 60% of the stretch if I pull on a short stretch bandage. And the reason for that is I want the bandage to resist the contraction of your muscles when you move. When it does that, it pushes against the muscle, which push against the lymphatic fluid, and that will help move fluid as well. Compression garments, this is the ultimate goal of decongestive therapy. We want to get you into maintenance compression. Compression is the gold standard for lymphedema treatment. Massage is great, manual lymphatic drainage is great. There is a lot of other modalities out there. At the end of the day, compression is what's going to keep your arms small, prevent the lymphedema from progressing, and help prevent your skin from becoming hard or developing wounds. There's a lot of different styles and types of compression out there. It's like $1 billion industry. You could go down a million rabbit holes trying to figure out all of the things out there. Most of the time, patients will do fine in this compression class. This is how strong the compression is or how tight it is. Compression class 1 is 20 to 30. Compression class 2 is 30 to 40. So someone with a more advanced lymphedema will need a higher level of compression. They come in a lot of different colors, styles. The texture of the fabric can change, the coverage can change. Some of them come as one piece. This lady has a gauntlet sleeve all in one. You can have a gauntlet or a glove and a sleeve separate. A lot of it is trial and error. You may not land on the one that works for you the first time around, but it's so important to have well-fitting, appropriate compression. Most of the time for patients with lymphedema in their arm, I think that having a custom compression garment is the most appropriate because it will fit your unique your unique limb. Everyone's limb is different. Some people have bigger arms, some people have skinny arms, some people have a very large upper arm and a small forearm. In all of those cases, you want something custom to make sure that fluid moves effectively and we don't get any limb constriction or skin irritation, which can make swelling worse. Um, there's ready to wear garments, which they come in a more of a variety of measurements. The fitter will measure your arm, look at a chart and see what size you fit into and give you the garment. The custom garments are made of a slightly different fabric. It's more of a like a flatter, thicker fabric, and it's made to measure, meaning that the fitter will take a number of different measurements and send them overseas to a company in Germany to basically make the garment for you. It takes a few weeks, but that garment is meant to be yours and yours alone. Um, it's better for severe swelling. It's better for people who have irregular limb shapes. In my experience, I think it works better in the long term for people with lymphedema in their arm. Garments are meant to be worn every day, but the daytime garments are not meant to be worn at night. At night, they have specialized garments. They are not as strong in compression as the daytime compression garments, and they're textured, oftentimes to address scar tissue or fibrosis while you sleep. This garment on the right here, you can see that it's got a bumpy texture to it. It's kind of chunky, not necessarily something that you would want to walk around in all day, but it's perfect for nighttime because it likely is not as strong of compression, and these little bumps will help give your skin a micro massage and help break down scar tissue, because the less scar tissue you have, the better drainage you will achieve. Compression is a lifelong commitment, because lymphedema is a lifelong condition. So, once you have lymphedema, you will need to wear compression probably for the rest of your life. It depends, everyone's different. Everyone's limb refills at a different rate. It's really difficult to know exactly what your compression recommendations are without looking at you and seeing how your arm behaves to therapy, but it's if you wanna make sure that your lymphedema is well controlled, being consistent with your compression is paramount. It's important to also recognize the role of exercise in managing lymphedema, especially while you're wearing compression. So here in this picture, you can see this green little vessel. It has a little valve or like a doorway or trap door, sort of like your veins. And it is nestled here in a bunch of fat. There's the skin on top. And this meaty looking stuff down here is muscle. So if you imagine when you say walk or move your arm, your muscle is going to contract and push against this lymph vessel. Out here, if you're wearing a garment or bandages, the stiffness of those will push back and fluid will move along that vessel, even if there's damage there. These are some basic decongestive exercises for people with lymphedema. These are really meant to be done while after manual lymphatic drainage, after your bandages are applied, and then you just run through these exercises really quick to help move that fluid along. You can also do typical gym workouts. If you are an active person, um, return to your typical gym exercise. The guidance there is to just be mindful of how you use your arm. You really don't want to avoid using your arm. They used to tell cancer patients not to lift after having breast cancer surgery and treatment. The thought used to be that overuse of the arm could either exacerbate lymphedema or cause lymphedema. And the recent research over the past 10 or so years has shown that this is actually not the case. You want to have a nice, strong muscle so that you can have a good, strong muscle contraction that will help move fluid along the system, even if there's damage. So, if you are an exerciser after your surgery, you go back to your exercises as long as you start slowly and then you gradually increase the intensity. Anything that causes pain that lasts longer than a week is a sign that you need to back off. Again, you have to listen to your body, and listen to your internal cues. How long are you sore for? Are you having any heaviness in your arm that lasts longer than a couple days after you work out? Are you noticing any changes in the way your clothes or jewelry fit after you work out? You'll have to be really diligent and monitor the affected area for changes. If you have lymphedema and you're returning to exercise, wear your compression garment when you exercise. It can only help. It will help move fluid as your muscles contract. So going more into, we have all this information now on what puts you at risk. So the more lymph nodes that are removed, having radiation to your armpit, at your collarbone, certain types of chemotherapy, um, having a body mass index greater than or equal to 25 or 30, all of those things can put you at risk. Um, and then what do we do with that? That's a lot of information. And I know with me, if I am given all of those risks, I'm gonna not want to get out of bed in the morning. And that's not what we want. We want you to live your life with the knowledge that you know how to prevent this and give you the tools to act early and prevent things from getting worse. So we don't want you to think about it in terms of precaution. We want you to think about it in terms of precautions, not do's and don'ts. There's no hard and fast rules to this, which is hard for some people. There's a lot of gray area in lymphedema science and lymphedema care. But if you understand the guidelines, then you're empowered to make choices. I really like to say, like, I can give you choices, but you are the one who gets to make the decisions. And if you're aware of all the choices and options available to you, then that should be empowering. So here is the most recent evidence-based recommendations for reducing risk for people who are at risk for lymphedema. So these are for people who do not have a diagnosis of lymphedema. Um, I wanted to emphasize here that there's not a lot of evidence that supports things like avoiding blood pressure on the involved arm or blood draws from the involved arm, using sleeves when you fly, and avoiding extreme heat. A lot of people are really eager to do as much as they can to prevent lymphedema right out the gate, even if they don't have it. But an isolated blood draw or blood pressure taken on the involved arm, there's no evidence that that will cause lymphedema in someone who's at risk. Things like you may prefer to use the unaffected arm when it's practical for a blood pressure, blood draw, or an injection. Um, if that makes you feel better, if there's an emergency and they do a blood pressure or blood draw on the involved side, it's not the end of the world. Um, when you are flying, if you're flying, you can use a compression garment when flying preventatively. However, you have to make sure that it fits well, because an ill-fitting garment can cause more harm than good. You still want to avoid extreme heat to reduce risk. People do tend to swell when it's very hot, so I would still avoid a sauna, if possible. Um, Air travel has not been associated with an increased risk of lymphedema. Again, if you prefer to wear a garment, make sure that it's fit properly, and exercise, supervised, slowly progressive, all strengthening, cardio. It's all safe. It's all encouraged. It's good for you. People who exercise have a lower risk of lymphedema than people who don't exercise. And then up here, it talks about what's called prospective surveillance. And that's just seeking access to lymphedema care, including baseline measurements and then follow-up measurements based on your risk. Um, the self-monitoring is important. Um, some people report really vague symptoms to start. If anything feels off, then go to the doctor first and access lymphedema therapy. Even people who have no visible swelling can report some really vague symptoms and end up having lymphedema. So trust yourself. You're probably not crazy. But that's what everyone says. They say, I think I'm going crazy, but it's something to pay attention to. You know your body. So for patients who have been diagnosed with lymphedema, you really want to emphasize minimizing your risk of infection. Having chronic swelling does put you at a higher risk of infection than someone who does not have chronic swelling. It just takes longer in this instance for things that fight infections to get to areas that are where you have a wound or a cut. So being really diligent with your skincare, showering, basic hygiene, applying moisturizer, nail care, making sure that your cuticles are, not ripped to shreds. Um, some people prefer to use an electric razor instead of a regular razor, protecting yourself in the sun, wearing bug spray when you go outside. All of those things are common sense ways to prevent infections. Here, also, once you have that diagnosis of lymphedema, you do want to avoid, when you can, blood pressures and blood draws on the affected arm, extreme hot temperatures, such as in a sauna or hot yoga, and then use your compression garments as prescribed by your lymphedema therapist during exercise and flying. Again, slowly progressive strengthening and cardio exercise is safe and encouraged. People with lymphedema should exercise. It's very important. It will help keep it from progressing along with use of compression. Um, for any surgeries after breast cancer treatment, like say you broke your arm on that side, let your surgeon know that you have a history of lymphedema and have them put in an order for lymphedema therapy once that you've cleared your post-op restrictions. Try to monitor yourself every 6 to 12 months, or have them go to lymphedema therapy every 6 to 12 months for your compression garment fitting, for measurements to make sure that your swelling hasn't worsened, just for a tune-up. And again, knowing your body and self-monitoring is of utmost importance. If you do get swelling, like I said before, call your doctor to rule out other causes of the swelling, like an infection or blood clot. Some of the signs of infection are redness, warmth to the area, flu-like symptoms like fever, chills, a really rapid increase in swelling, and lymph nodes that are tender, and localized pain. In the times that someone has presented to our clinic with an infection, they're usually very, very, very tender to touch. And the signs of the infection came on really suddenly. So, anytime something like that happens, best to go to a doctor first, make sure it's not an infection. If you do have an infection, we wait until you've been on antibiotics for 24 to 48 hours before we restart therapy, as long as your symptoms have improved. For a blood clot, it's somewhat similar to signs of an infection where you have some redness and warmth, pain. And once you go to the doctor, and either if you have a blood clot, get put on a blood thinner or get cleared by the doctor, then we can resume therapy again. A certified lymphedema therapist is the type of therapist you want to seek. A lymphedema therapist or certified lymphedema therapist has specialized training in lymphatic anatomy, physiology, manual treatment techniques, and bandaging. We are required to undergo 135 hours minimum of training and examinations in person. So the course is usually around, I think, 14 days, something like that. And it's a very intense training period. So there's no law that says you have to have these credentials to practice lymphedema therapy. In fact, I see people advertising for performing manual lymphatic drainage without the credentials all the time. But you really want to make sure that the therapist you're seeing has the CLT or CLT-LANA designation. And that LANA designation is that's like a board certified expert lymphedema therapist who's taken an additional exam to show that they are extra super smart and competent, like Amanda. Here at Endeavor Health, we have physical and occupational therapists that do lymphedema rehab. At our Bannockburn clinic, we have a number of lymphedema therapists treating breast cancer patients, patients with other forms of lymphedema. We also treat patients who are just recovering from their breast surgery or radiation. You don't even need a diagnosis of lymphedema to come see us. At Skokie Clinic, it's just little old me, but again, I can see any type of lymphedema patient, do breast cancer surgery rehab, and help you monitor yourself for lymphedema symptoms. All you need is a doctor's order to get that done. Most of our orders are coming from the medical oncologists, plastic surgeons, oncologic surgeons, radiation oncologists. So any of those doctors involved in your cancer treatment can help you get started with us. And I put the numbers there. That's where you would call to schedule a evaluation. And that's it for my presentation.